Hi guys, welcome back to my channel. So in this video, I'm going to talk about my interest in applying for CRNA program. So CRNA, if you're not familiar with CRNA, because if you're not nursing or healthcare, right? So CRNA is basically Certified Registered Nurse Anesthetist. Uh, at first, I was, when before, like I didn't know what's the difference between a CRNA and an anesthesiologist, but they're two different people because CRNA is kind of under because it's a nurse job, so they're under anesthesiologist because the anesthesiologist is in charge of multiple patients. CRNA just focus on the patient that they're working on. So uh, again, the top schools of CRNA are kind of like varied every year. I'm guessing because they base the ranking on different factors, right? So, but I think the one I saw, like one of the top schools for CRNA, would be Army Baylor nursing program, and then there's other programs as well. But yeah, it depends on what school you want to go to, and again the requirements of the school. So for basic minimum requirements to be eligible to apply for CRNA, I saw, like, of course, like the common one would be you have to be a BSN graduate, and you have to have your BSN nursing degree. After that, you have to, what do you call this? Again, pass the NCLEX after you graduate because you need to practice nursing, right? So you have to also, if you become a nurse, you have to get ICU or CICU experience. So most CRNA programs I read that they require around like 2 to 3 years of ICU. Some probably like nurses who apply for CRNA program, they've been actually working as a nurse for almost 5 years, and they were saying you have to be careful if you're interested in CRNA program that there's some ICU experience that might not, like count towards the requirement. Like, for example, some schools may not consider neonatal ICU as a proper experience to apply for CRNA. So if you have a school in mind for CRNA, you have to ask them like what they actually require so that you can work your way to it. Because it's kind of like sad if you thought it was like what do you call this, like going towards the program, and later on, and when you verify with them that it's not really like counted towards it, so you have to like extend your wait to reapply, because again it's a process also. Aside from the critical care experience that they require, I read that some CRNA schools prefer or require you to get your CCRN certificate. It's basically like the one that's been given by the American Certified Critical Care Program. So once you get that, it just shows that you're really interested in critical care, and that's gonna help your application to the school. Also, aside from that, GRE, it's like a SAT for graduate school. So I think the minimum requirement for most of the school are above 300, so you need to score 300 to be competitive or even being considered. But again, it varies also, because they were saying that some schools may not require you to get or take the GRE if you already have your graduate, if you have already a master's degree on something, or if your GPA is high enough that they can waive it, right? So that's the reason why that for CRNA school, the minimum cutoff GPA is 3.0, but since some of the programs are very competitive, they kind of like encourage people to get at least like 3.4 GPA to be able to like apply for the program. Aside from that, I read that you also have to get your BLS, your pediatrics advanced life support, and then your also ACLS, advanced cardiac life support. So those three are required to, or I'm not sure if it's actually required or just recommended to be that you have it, because again it's like if you're CRNA, those are the areas that you're gonna be working on as well, like in critical care. Aside from that, they were saying the other requirements, or I think the other requirements aside from what I mentioned was like letters of recommendation, and also you have to shadow other CRNAs and you have to document that. I think there's like a certain amount of hours, like 8 to 40 hours of shadowing that you have to prove that you actually like work with the CRNA and get the time that they need for that requirement. And also some schools may require like prerequisites. I saw that they might ask you to take biochemistry, organic chemistry, health assessment. Again, it depends on the school. So and yeah, so those are the requirements that I saw for CRNA. So it's like one of those degrees that it may not you're not going to be able to apply right after you graduate from your BSN program. So you have to like actually build your resume and kind of like work towards it if you want it. So as of now, it's the route that I want to take. Again, they told me also not to close my door because there's so much what they call this like nursing graduate programs that are available. You can just like take masters. For now, I'm taking my MBA, Master in Business Administration. I'm already over halfway done. So basically, if I finish my MBA like within 6 months after my getting my BSN, hopefully I would be able to waive the GRE requirement for CRNA program. Again, also if I already have my master's degree or MBA, I might not even pursue CRNA because it's already a graduate degree. But I just want to get the CRNA. I don't know why. It's challenging because it's fast paced and you learn a lot. Also my mom is an anesthesiologist, so that's why like I want to go to that route of being in that profession because yeah, it sounds fun for me. All right guys, thank you guys for watching.